Thank you so much for coming and the privilege of being here. I want to thank Manal for setting this up. I've been lecturing, I think, for 25 or 30 years, and I've never met anyone as passionate as she is about developing a platform for education. It's really quite remarkable, and you're doing it for the right reasons. You're not trying to create a company, you just love what you do. And I also want to thank the Egyptian Society of Radiology for their support. Without your generosity and your support, this would not be possible. And I compliment you and your vision and the goal, which is trying to make radiology more accessible for everyone in the country and eventually improve the quality of care for everyone. So it really is a wonderful collaboration, something that we really don't see very often, and people are doing it for the right reasons. And I hope to attend the meeting at RSNA this year, where Egypt presents at RSNA. So congratulations on your vision and your leadership. And it's also good to see my friends here too. So what I'm going to do over the next, this talk will be for 45 minutes. And we Americans, we always like to stay on time, so I'll try not to run over. You know how we are. But I'm going to talk about a simplified approach to the spaces of the head and neck. And the biggest challenge that we have when we come to the spaces of the head and neck is that a lot of head and neck anatomy is just anatomy. And I don't know how the teaching is in Egypt, but in the United States, when we do our dissections and we learn our anatomy, we spend very, very little time on the head and neck. We'll spend a lot of time on the heart, we'll spend a lot of time on the leg, we'll spend a lot of time on the abdomen. But when it comes to the head and neck, there's very, very little attention given to anatomy. And as a result, with radiologists, we don't understand the basic foundation of the anatomy. And then all of a sudden, we have to look at imaging studies and identify the normal, then we have to identify the abnormal. So a lot of what I do is really based on anatomy. And then if you can understand the anatomy, then what I would say to you, everything else is pretty easy. So what I'm going to do is take a simplified approach to the spaces of the head and neck. The spaces have been around for almost 300 years. They were described by French anatomists at the turn of the 18th century. But they were re-identified with the development of CT and MR, because people realized we could look at cross sections and then we can see the spaces again. So the spaces were not created to torture residents in radiology. They were actually created many, many years ago, and so our job is to try to help with the anatomy. So the first thing that we'll talk about is we'll discuss the various spaces of the head and neck. And the first space that we'll talk about is referred to as the masticator space. So if I had to take my pointer here, I would draw my pointer here, and I would come around here and then come just like this. And this is the first space of the head and neck, because the first space of the head and neck is the masticator space, and all it is are the muscles of mastication. So we have to go back to medical school and understand what those spaces are. So this muscle right here is the lateral pterygoid muscle. This muscle right here, which is here, is the masseter muscle, and this is the medial border of the temporalis muscle. So the primary component of the masticator space are muscles. But there are other pieces of anatomy that we also have to remember, and there's a bone right here, which is the coronoid process of the mandible, and then we have the condyle of the mandible, which is located here. So the second component of the masticator space is bone. So we have muscle and then we have bone. And then if you look very carefully, there's another little oval-shaped structure located here, which is the third division of the fifth cranial nerve. So the three primary components of the masticator space are muscle, its bone, and its nerve. And if you understand that those three components of the masticator space are muscle, bone, and nerve, you'll be able to come up with a differential diagnosis. So this is an example of a very, very large mass here that's located in the masticator space. So there's our mass right here involving the masticator space. Now, how do we know it's in the masticator space? Well, for me, all I do is I find this big mass and I place my pointer or my finger right in the middle of it, and then I go to the opposite side. If I put again, right in the middle of the opposite masticator space, then I know I'm in that space. So if I draw down the line down the middle and I compare one side to the other side, then I think this mass is in that masticator space. So what do you think the most likely diagnosis of this mass is going to be? I think I just lost my, there we go. What do you think the most likely diagnosis is going to be? So if we know that the primary component of the masticator is muscle, what do we think it's going to be? Anybody? A what? Anybody? Sarcoma, right? Exactly. So part of the head and neck too is that we think of the head and neck and we think there are a lot of unique diseases in the head and neck. In actuality, there are very, very few diseases that just arise in the head and neck. We have to realize that the muscle is everywhere in the body, there are bones everywhere in the body, and there are nerves everywhere in the body. So in fact, if I showed you the same case and I told you there was an aggressive mass arising from the muscle in the leg, all of you would automatically start thinking about sarcomas. You think about rhabdomyosarcoma, leiomyosarcoma, etc. But once we talk about the head and neck, everyone gets scared of the head and neck, right? Because there's some type of voodoo magic involving the head and neck. There's really not. So that's part of the approach to the head and neck. So what if I tell you that this patient also has a mass in the masticator space? So I'm going to contour that mass right here. Everyone see that? And what if I told you that this was a 14-year-old or a 12-year-old male or a 12-year-old child? What do you think the most likely diagnosis is going to be of this mass involving the masticator space? In a child now, not an adult, but a child. What's the most common soft tissue mass involving a child? Most common soft tissue malignancy involving the neck in a child? What starts with an R? Rhabdomyosarcoma, exactly right. So that's how you can use this. We know it's arising from the muscle, we know it's in child, and this is a rhabdomyosarcoma. Now this is another example, and again, this is an example of a case involving the masticator space. So the largest component of the masticator space is muscle. The second component is bone. So what do we think this lesion is right here that's involving the condyle of the mandible? And again, you don't have to think head and neck. What if you saw this in a long bone of the body? What's the first thing that you would say? What's that? Starts with an O. Osteoma, exactly right. Now this is one of those strange head and neck cases that's arising from the masticator space, but it's actually arising from the bone. And here we can see expansion of the bone. Now this is one of those unique cases that involves the head and neck. And anybody want to take a guess what this is? It starts with an A. A great thought. Aneurysmal bone cyst? Great thought. Another one that starts with an A. AM. Have you heard of a medulloblastomoma? Yeah, so this was a medulloblastomoma. So either aneurysm bone cyst is a possibility. In this case, it's a medulloblastomoma. Now, here's the other component of the masticator space. So remember, what are the three components of the masticator space? It's muscle, it's bone, and what's the third component? Nerve, exactly right. So if I looked at the masticator space, here was our pterygoid muscle here, and there's a little nerve that's located right here. Everyone see a little oval-shaped structure there? That's the third division of the fifth cranial nerve. So in this particular case, we can see this mass right here that's located just medial to the lateral pterygoid muscle, and this is enhancement of the nerve. So in this particular case, this was perineural spread of tumor involving the nerve, and in this particular case, and someone can help me out here, we see a mass here that's located in the masticator space. Now the key thing here is, how do we know where this mass is? So what's the muscle that's located here that I just point here? That's the lateral pterygoid muscle, right? And this is the medial pterygoid muscle, and there's our masseter muscle here. Notice how the pterygoid muscle is displaced laterally, or displaced laterally. Everyone see that? So by understanding the anatomy, that tells us that this mass has to be located arising in this structure here, which is the nerve. So now we have a mass that's primarily involving the nerve, it's involving the masticator space, and it's displacing the pterygoid muscle laterally. And when we look at the coronal images, we can see this mass is extending superiorly through this foramen. And anybody know what that foramen is? It's oval shaped. Foramen ovale. So what do you think this mass is going to be? What's that? Schwannoma, exactly right. Perfect, perfect. Manal was telling me everyone was shy. No one's shy here. We're all friends, right? Yes. If you have the answer, sing out. We're all friends here. We're all here to learn, right? This is the classroom, right, Manal?
Yes, right.
Right, exactly. Interactive, exactly right. So the next space, so everyone understand the masticator space, right? So that's the muscles of mastication. It contains bone and nerve. Now the next space that we'll talk about is the visceral space. Now the thing about head and neck that makes it most difficult is that we take the same piece of anatomy and we give that anatomy different names. So if you read the different types of textbooks, the visceral space has different names to it. Sometimes it's called the visceral space, sometimes it's called the pharyngomucosal space. So there are various different names to it, so that's why it can get confusing. But back in medical school, when we were doing our dissections, we learned about the fascia of the head and neck. Does anybody remember the fascia of the head and neck? A little bit? Does anybody remember seeing the fascia of the head and neck? Probably not, otherwise we would be surgeons, right? So take what you remember about the fascia and forget it, okay? I'm going to teach you everything you need to know. So the term that I use to describe the spaces is I use the terms that were originally described in the 1930s. So I like to use a standard type of descriptive term. And this layer of fascia that I'm contouring right here, that's in black here, has a specific name, and that's called the visceral fascia. So what do you call the space that's contained by the visceral fascia? It's the visceral space. Now, how do you remember where the visceral space is? Well, it's pretty simple. If you open your mouth or look in your neighbor's mouth, it's a great way to meet people, right? If you look in their mouth and you look down their mouth, that is the visceral space. So if an ENT surgeon takes an endoscope and looks down someone's mouth, they're looking at the visceral space. So the other name of the visceral space has been the pharyngomucosal space, meaning looking at the mucosa of the pharynx. But the original name is the visceral space. So if you understand that the visceral space is essentially the mucosa, what do you think the most likely tumor is that's going to involve the visceral space? Squamous cell carcinoma, exactly right. And this is an example of a squamous cell carcinoma involving the nasopharynx. So this is just a classic example of nasopharyngeal carcinoma. Now, when we look at the visceral space, one thing that we always have to realize is here's a large mass here. And the majority of lesions involving the visceral space are going to have a non-specific appearance. So I'll tell you what, we're all friends here, right? I'll fly anyone from Egypt to visit me in Michigan if you can tell me what this diagnosis is. You ready? Okay, I just saved myself 2 plane tickets. So this is metastatic adenocarcinoma. It's impossible to know that. Absolutely impossible. But that's not the purpose of this. Why? Because the purpose of imaging is to identify information that cannot be provided on clinical examination. So the surgeon can come in and they can do a biopsy here, and they're the ones that will tell us that this is metastatic adenocarcinoma. Now, this is something that we oftentimes see in a child. So you look at a child, sometimes they'll have a little difficulty breathing, but this is a normal variant in a child. So, but anybody want to say what this is right here? This is what? Lymphoid tissue. This is normal adenoidal tissue. Remember, children have a lot of adenoidal tissue. This is a enlarged retropharyngeal node. Here's the carotid artery. So when you see something like this in a child, most times it's just hypertrophy of adenoids. The other thing that tells us that it's not an aggressive lesion is that notice how there's no extension through the visceral space into the adjacent spaces. So this hypertrophy of the adenoidal tissue respects the boundary of the visceral fascia. How about this? This is a non-contrast T1 weighted image demonstrating this mass here that's located below the mucosa. It's non-contrast T1 and it's high signal on T1. Anybody know what this is? Starts with a T. Tornwell cyst, that's exactly right. Okay, perfect. So far we've gone over the masticator space and the visceral space. And how do we remember we're looking at the visceral space? Because we look in someone's mouth, right? All right. So the next space that we'll talk about is the retropharyngeal space. So what was the other name of the visceral space? It was the pharyngomucosal space, which means we looked at the pharynx. So now, what do we call the space that's located behind the pharynx? That's the retropharyngeal space. So if I had to contour here, here's the visceral fascia that's located here. Everyone see this here? Now, the area that's behind the visceral fascia, which identifies the pharynx, is called the retropharyngeal space. Now, for the head and neck radiologists here who really like head and neck, behind the visceral fascia, there's actually two layers. So we have this layer here, which is called the alar fascia, and another fascial layer here, which is the prevertebral fascia. So actually, the area between the visceral fascia and the alar fascia is referred to as the true retropharyngeal space, and there's an area between the alar fascia and the prevertebral fascia that's referred to as the danger space. But for you as general radiologists that are probably going to forget everything I say in the next hour, if you can remember tomorrow on Sunday that the space behind the pharynx is the retropharyngeal space, I'm going to be very, very happy. That's really all you need to remember. So this is an example of a patient that had penetrating trauma, and this is all air dissecting in the retropharyngeal space. So here's an example of a patient that has a normal variant. Anybody know what this is right here that's wandering its way in the retropharyngeal space? What's that? Internal carotid artery, exactly right. So this is the classical example of a carotid artery that's extending into the retropharyngeal space. Perfect. Shout out those answers. Now this is another example of a patient that has a mass in the retropharyngeal space. And when we look in the retropharyngeal space, we can see these green structures right here. And anybody know what these green structures are? Lymph nodes, perfect. And what are these lymph nodes called? Anybody remember? It starts with an R. Nodes they're called the retropharyngeal lymph nodes, but they're also named after a French anatomist. It starts with an R. R-O-U-V-I, Rouvier. Anybody, have you heard the nodes of Rouvier? Well, you have now, right? So they're also known as the nodes of Rouvier. So this is an example here on your right-hand side of a metastatic retropharyngeal lymph node. Now, why is this so important? Because these retropharyngeal lymph nodes cannot be palpated on clinical examination. They can only be seen by our imaging study. So that's why it's very important from a staging standpoint. So this is that retropharyngeal space. And here's another example. So this is a patient that has a fluid collection and has a fever that's involving the retropharyngeal space. Now, does anybody know what this is? Yeah, so typically we think it is an abscess, but in actuality what this is, and if you say abscess, you're completely right, but what this really is pus that's located in a retropharyngeal lymph node. Because notice how this fluid collection is off the midline. So this is the term that we use here is suppurative adenitis. This is pus in a retropharyngeal lymph node. Now this, on the other hand, you see this fluid collection that's extending all the way over midline? This is a true retropharyngeal space abscess. So initially the pus starts here in a retropharyngeal lymph node. This gets bigger and bigger and bigger, and eventually it explodes and extends into the retropharyngeal space. Now, why is this important to separate out? Because if the surgeons see something like this that's localized midline, then this can be treated aggressively with antibiotics. But on the other hand, if you see something that's big like this is a true retropharyngeal space abscess, and this needs to be surgically drained. Okay? So, how do we remember the spaces? The first space was the muscles of mastication. The next space was if you look in someone's mouth. And the third space was behind that person's mouth. Now, the fourth space here is the prevertebral space. And remember, as I said before, in head and neck, we take the same piece of anatomy and we give it different names. So if we use the spaces approach, this is what we refer to as the prevertebral space. But the prevertebral space is also the spine. So if you've ever looked at a spine CT or a spine MRI scan, you've been looking at the prevertebral space. You may not have called it the prevertebral space, but you're looking at the prevertebral space. So this is an example of a patient that has a mass in the prevertebral space. We can see there's aggressive erosion here. The patient has a fever. There's extension here into, what space is this fluid located here? We just talked about it. Retropharyngeal space. And in this case, we have this discitis and osteomyelitis extending posteriorly into the spine, resulting in an epidural abscess. Now, this is a disease we don't see a lot in the United States, but you see a lot of this in Egypt. Anybody know what this is? TB, exactly right. Now, this is one of those cases that you see that's typically involving a unique to the head and neck. This is a mass that's involving the top part of the notochord. You can see it's enhancing, but when we look at the T2 weighted images, we can see it's very high signal on T2. And these lesions typically occur at the proximal end of the spinal cord and also at the lower end of the vertebral body. So what does this, anybody? Starts with a C. Chordoma, exactly right. Excellent, perfect. And this is just an example to emphasize the point. And this is just a neurofibroma that's just involving the prevertebral space. And again, I just show it just to emphasize the point. Now, this is an example, and we'll see this later, and we'll see how good your retention is. This patient presented to the emergency room in the middle of the night and presented with neck pain and didn't have a fever. But what we can see here is a new calcification right here involving the longus colli muscle. So does anybody know what this is called? Someone's shaking their head. Anybody? Said it. Anyway, this is calcific tendinitis. And we'll talk about this a little later. But realize that the prevertebral muscles are also part of the prevertebral space. So we'll talk about this later when we talk about things to look for in the middle of the night. Okay? Now, so where have we done so far? Masticator space, visceral space, retropharyngeal space, prevertebral space. So what do we call the space that contains the parotid gland? It's parotid space. It's really that easy. The head and neck is not bad. So I'm going to test your memory, okay? I'm contouring a space right here. What space is that? What's that? Masticator space. Perfect. What space am I looking at right here? Visceral space. Perfect. What's the space that's located behind the pharynx back here? Retropharyngeal space. And what's the space that's located right here that I'm contouring? Prevertebral. You got it, right? Spaces are easy, right? If you want to do something hard, do mammography, okay? I have no idea about mammography, but spaces are easy. So the next space, pure and simply, is that space that contains the parotid gland. So if I had to contour the parotid gland, I would contour it like this. Now, there's a specific nerve that's associated with the parotid gland, and what's the name of that nerve? The facial nerve. And this is a lovely example of the facial nerve that was given to me by my friends from Argentina. So we have a little collaboration here. It says this is the main trunk of the facial nerve, and these are the various 7 branches of the facial nerve that's seen here. And this is an example. Has anybody ever heard of Bell's palsy? Right? This was actually the paper. This diagram came from Bell's original article on Bell's palsy. So even back then, you can see this very lovely anatomic description that was created by Bell many, many years ago. So the facial nerve is located within the parotid gland. Now, how do we identify where the parotid gland is located? There's a specific vessel in the parotid gland that tells us where the facial nerve is. And that vessel is located right here. So what do you call the name of this vein that's located behind the mandible? What's that? The retromandibular vein. That's why it's called the retromandibular vein. There's nothing magical about it. It derives its name because there's a vein that's located right behind the mandible. And the facial nerve is located just lateral. Here, it's just lateral. I'm going to go to the other side too. Just lateral to the retromandibular vein. And the facial nerve divides the parotid gland into a superficial lobe and a deep lobe. So here's an example of 2 parotid space masses. They're located bilaterally, and they're located at the tail of the parotid gland. So does anybody know what this is? It starts with a W. These masses tend to be bilateral. They tend to be multiple. What? You got it. You're well trained. Who trained you anyway? She spent some time with me in Michigan, so it's great to see her again. And this is an example. What if I told you that this patient was HIV positive and we see these multiple cysts in the parotid gland? Then what do we think this is? What's that? What was that? Yeah, not Sjogren's. What if I told you it was HIV positive? Yeah, lymphoepithelial cysts. Exactly, perfect. And then here's an example of a patient that has a unilateral mass. In this case, it's involving the superficial lobe. And these lesions typically involve the parotid gland. They can extend deeply into the parapharyngeal space, and they're high signal on T2. And so this is the most common benign tumor that involves a parotid gland. It starts with a P. What's that? Pleomorphic adenoma, exactly right. That's perfect. All right. We doing okay so far? Remember where the spaces are? So again, I like to repeat myself because repetition is good, right? And if I'm boring you, that means that's good. Because if I'm boring you now with the spaces of the head and neck already, that means you're learning the spaces, right? So, number 1 is masticator space, number 2 is visceral space, retropharyngeal space, prevertebral space, parotid space. Now, what do we call the space that's next to the pharynx? That's the parapharyngeal space. So remember, this was the visceral space, which is also called the pharynx. And this space that's located just lateral to the pharynx is the parapharyngeal space. So if you ever wonder where it got its name from, it's the parapharyngeal space. And just to emphasize, what do we call the space that's behind the pharynx? That's the retropharyngeal space. And just for grins, what's the space here? Masticator. Good. And what's the space that's located here? Got it. Easy, huh? All right. Any residents here in the audience? Are there residents here? You're too scared to raise your hand, huh? Yes. A lot of residents here, okay? I see you. I see you. And I see you right here, so you're in trouble. So this is just an example of a patient that is, oops, let me get back to my pointer. This is an example of a patient, oops, sorry about that. There we go. So this is an example of a patient that has a mass in the parapharyngeal space. And how do we know it's in the parapharyngeal space? Because the main thing that I want to emphasize here is that notice how the pterygoid muscle is being displaced laterally. And notice how the pharynx is being displaced medially. And look at the carotid artery. Where's the carotid artery? Is it being displaced anteriorly or posteriorly? What's that? Posteriorly, exactly right. So when we see that posterior displacement of the carotid artery, that tells us that the mass has to be involving the parapharyngeal space. Keep losing my, there we go. Okay, perfect. Okay. And another example here. Here's a mass involving the tonsil. What's the space that's located right here? This was the, oops, sorry about that. I keep messing myself up here. Sorry about that. Let me go back to my pointer. Come on. There we go. Perfect. So what's the name of the space that's located right here? Parapharyngeal space. And look at on the opposite side. See how the parapharyngeal space is narrowed? So this is actually squamous cell carcinoma of the tonsil extending into the parapharyngeal space. So the most common tumor to involve the parapharyngeal space is a pleomorphic adenoma. But the most common tumor to extend into the parapharyngeal space is squamous cell carcinoma. All right. Now, here's the next question I'm going to ask you. Where's a resident? Hello. I have a very hard question for you. You ready? Are you smart? What do you call the space that contains the carotid artery? Ah, you're very smart. That's exactly right. So the next space is the carotid space. So again, let me just go back to my diagram here. This was the, what space was here? What space was that? Masticator space. What was the space that was located here? Good. The space back here was the, perfect. The space here next to the pharynx was the, and the space back here that's in red is the carotid space. So what's in the carotid space? You have the internal carotid artery, you have the internal jugular vein, you have a variety of cranial nerves, which is 9 through 12. You also have lymph nodes, and then you have the sympathetic chain. So these are the components of the carotid space. And the reason why I show this to you is that if you can, again, understand the anatomy, then you can come up with a differential diagnosis. And remember, the anatomies are an artery, a vein, nerves, and lymph nodes, okay? So this is an example of 2 cases of different lesions involving the carotid space. And you know this already, but you may not remember it in the head and neck. So what do we think that this lesion is right here involving the neck? It's involving the carotid space. It's a what? It's an aneurysm, right? And what about this abnormality here? This was a patient that had a central line placed, and now we can see there's something wrong here. So what do we think this is? Thrombosis involving the internal jugular vein, exactly right. These are all masses involving the carotid space. There's really no magic behind the head and neck. Here's another example of a patient that has an abnormality involving the carotid space. This is a non-contrast T1 weighted image, and we can see this eccentric area of increased T1 signal, and the caliber of the carotid artery is narrowed. That's exactly right. This is a dissection. Again, another carotid space mass. Now, this is an example of a carotid space mass. I want to spend a little bit of time going over it. Is that, first of all, how do we know it's in the carotid space? The reason is here's the carotid artery. And which way is it being displaced? It's being displaced anteriorly. If the carotid artery was being displaced posteriorly, then what space would it be in? Parapharyngeal space. You got it, right? Perfect. So now we have a mass in the carotid space. And this is a non-contrast T1 weighted image. And this is a T2 weighted image. And when we do an MRA, we can see there's displacement of the internal and the external carotid arteries. But there's no enhancement within it. So what do we think the diagnosis here is in this case? What's that? Nerve swirl. That's perfect right. This is a schwannoma. That's exactly right. And I showed you this for a specific reason, because anytime I show a carotid space mass, the first thing that someone says it's going to be a what? A glomus tumor, right? Everyone says that, right? This is a glomus tumor. So here we have a mass involving the carotid space. Everyone see this here? This is a contrast-enhanced T1 weighted image. Notice how the carotid artery is being displaced anteriorly. Everyone see that? If the carotid artery was being displaced posteriorly, then what space would the mass be in? Parapharyngeal space. But this is being displaced anteriorly, so it's in the carotid space. The next thing we look at is, once we've properly identified it in the carotid space, we then need to look at the internal architecture. And when we look at the internal architecture, what are all these black dots here? Flow voids, exactly right. So now you have flow voids in a carotid space mass, and this is the angiogram. So this is a what? This is a glomus tumor. That's exactly right. All right. So we're almost done with the space of the head and neck. We just have 2 more to go. So the next thing I'm going to ask you is, what is Greek for tongue? Anybody? What's Latin for tongue? Lingua. What's Greek for tongue? Starts with a G. Glossus. Exactly right. Now, why do I ask you this piece of trivia? The reason is, one of the things that I mentioned earlier was that in the head and neck, we take the same piece of anatomy and we give it different names. So for instance, when we were talking about the parapharyngeal space, some people will call this the prestyloid parapharyngeal space. When we were talking about the carotid space, some people will call this the poststyloid parapharyngeal space. So it's different anatomy, it's different names for the same piece of anatomy. When we talk about this next space, which is a sublingual space, we're talking about the space below the what? Below the tongue. That's exactly right. That's a sublingual space. But When we talk about the muscles of the tongue, so if I go to this, and we go to the muscles of the tongue, and this muscle runs from the genial tubercle back to these transverse fibers, which is the tongue base, what do we call that muscle then? Genioglossus. So when we talk about the spaces in lingua, we're talking about Latin and below the tongue. But when we talk about the muscles, we're still talking about the tongue, but we're using the different root. Does that make sense to everyone? So again, that's where part of the confusion comes in. So let's talk about the anatomy of the sublingual space. The sublingual space is very simple, the space below the tongue. So remember that friend you asked to open their mouth to look at their visceral space? If you'd like to take the relationship to the next level, ask if you can palpate their sublingual space, okay? It's a great way to meet people, okay? Right? So that's a joke, okay? Do I need to say that in Arabic or not? It's lost in translation here, okay? So anyway, the space that's located below the tongue is located in the sublingual space. So what are the borders of the sublingual space? So the sublingual space is formed laterally by this structure here, which is the what? Mandible, the rim of the mandible. Then the wall of the sublingual space is formed by this muscle here, which is the what? It starts with an M. Mylohyoid muscle. And then at the base of this is a bone right here, which I'm contouring. And what's the name of that bone? That's a hyoid bone. Exactly right. So essentially everything that's located medial to the mandible, but that's above the mylohyoid muscle, and the hyoid is located within the sublingual space. So if you think the way I do, I think of the sublingual space as a teacup. So let me see if I can explain the teacup to you. So what do you think forms the rim of the teacup? It's formed by the mandible. What do you think forms the wall of the teacup? Which muscle? Mylohyoid muscle. And then what do you think forms the base of the teacup? The hyoid bone. So the way I think about it, when I look at this anatomic structure on the left-hand side, this looks like a teacup to me. And then everything within the teacup is located within the sublingual space. Does anybody else see it, or is it just me? One person sees it. All right, two people see it. Thank you very much. Okay, very good. So what's the most common tumor to involve the sublingual space? Well, pure and simply, it's squamous cell carcinoma, as is located here. And notice how it's medial to the mandible. Now here's an example of a patient that presents with a fever and presents with a mass in the sublingual space. And what we see here is all of this abnormality here. So what do we think this is? This is a what? What's that? Abscess, perfect. And when we have a sublingual space abscess, the next place where we have to look at is the mandible. And when we look at the mandible, we see a lot of sclerosis, and with a leap of faith, we can see a rotten tooth, right? Everyone see that tooth right there? Perfect. And then these are two examples of pathology involving the sublingual space. Now let's start with the one over here on your right. So now we have a mass that's involving the sublingual space, and it's paramidline, extending posteriorly, and it contains fluid. And it's directly adjacent to the gland that's located here. So what do we think this is here on the right side? Ranula, exactly right. And now what about this abnormality on your left-hand side? Now this is an anterior midline mass. It's not posteriorly, but it's anterior midline. So what do we think this is? Epidermoid, exactly right. Manal, they're beautiful here. They're not shy.
I'm proud of them.
And you're very proud. This half of the room is much more interactive than this half of the room is. So we got to work on you guys. All right. I'm going to start calling on the president of the Egyptian Society soon. No, I'm just kidding. And the last space that we'll talk about is a space that's below the mandible. So what do we call the space that's below the mandible? It's pure and simply the sublingual space. Now I just have a couple of minutes left. Let me see how much time I have left. I've got 6 minutes left, okay? So what I'm going to do is I'm going to quiz you, right? Now we're looking at a coronal image, right? So I'm going to ask you, what space are we looking at, so I get my pointer to work. What space are we looking at right here? Perfect. Now you've got the spaces on the coronal image. See how good you've gotten, right? And then what's the space that's located right here? Sublingual. So here's the mandible. So the submandibular space, it's located anywhere below the mandible. So when we look at that area below the mandible, what's some of the anatomy within the mandible? What's that? Glands. Yeah, glands is number one. And what's the second most common thing? Lymph nodes, exactly right. Now, how many of you, I don't know if you have pets in Egypt. Do people have pets in Egypt, dogs and cats? Okay, yeah. So how many of you have a dog, a cat, or a spouse? Right. So have you ever gone to your dog or your cat and done like this to them? Have you ever done that to your spouse? No, okay. So if you ever do this to your dog or your cat, what you've been doing is that you've been doing a physical examination on their submandibular space, believe it or not. So if you remember your dog or your cat, you'll always be able to identify the submandibular space. So identify the visceral space, look in someone's mouth. To identify the submandibular space, just rub yourself under someone's chin, and then you'll be able to identify the submandibular space. So what are some common pathology to involve the submandibular space? As I mentioned earlier, one of the most common things that we'll see are lymph nodes involving the submandibular space, and these are all multiple lymph nodes that are involving the submandibular space. Now, this is an example of one of the most common reasons we do imaging to involve the submandibular space. This patient presents with a left-sided neck mass. Now, you may look at this and say, my gosh, it's an enlarged lymph node. But what we want to be able to do is draw a line down the middle and compare one side to the opposite side. And when you see one side to the opposite side, is this a lymph node here? No, what is this? Submandibular gland. So you see the submandibular gland, and you can see with a leap of faith, there's a dilated tract right here. Everyone see that? So the submandibular gland that drains into the sublingual space, and it crosses over the free margin of the mylohyoid muscle, and then it courses anteriorly until it reaches the frenulum. So in this particular case, what's the cause of the dilatation of the duct? And does everybody see the stone right here? Exactly right. This is one of the most common reasons you'll be doing imaging. It's that simple. Head and neck is not that bad. If you understand the anatomy, then you'll understand the head and neck. And this is I think the second to last case, is that this patient, again, has an enlarged mass here. Everyone see this thing right here? So is that a lymph node here? No, it's not. So now we have an enlarged submandibular gland, so we have to figure out what's causing this. So understand the anatomy. What's going to cause a dilatation of the submandibular gland? It's going to be some obstruction to the duct, right? Where does the duct normally course? It courses in the sublingual space, correct? So if I draw a line, again, down the middle, and I compare one side to the other side, right? So let's take a look. Does anybody see the abnormality here? Yes, asymmetry, right. Explain the asymmetry. Is the asymmetry at A, B, or C? B, perfect. Everyone see this right here? That's a very, very subtle squamous cell carcinoma involving the submandibular, or involving the floor of the mouth. And that's what caused this patient to have that dilated duct. And this is the last thing that we'll talk about here. We talked about this diagnosis before. This is a fluid collection that's located in the lateral aspect of the sublingual space, and this thing can extend inferiorly through the mylohyoid muscle and involve the submandibular space. So what's the name of this pathology again? A ranula. Now, someone said diving ranula. I'm glad you said that. In head and neck, we take the same piece of anatomy and we give it different names. So this ranula that extends below the mylohyoid muscle has 3 names. One's called diving. Anybody know what the second name is? Plunging. And anybody know what the third name is? If it's not simple, it's complex. So this type of ranula that extends from the floor of the mouth through the mandible into the submandibular space has 3 names to it: plunging, diving, or complex. Again, very simple anatomy, and we just make it more complex. And the reason why that's important, because if we say it extends into the submandibular space, the surgeons typically have to perform an open resection to remove that. So in summary, what I've tried to do over the last 45 minutes is talk about the spaces of the head and neck. So just to reiterate one more time, masticator space is what? It contains the muscles of mastication, bone, and what was the third component? The nerve. The visceral space, how do we remember the visceral space? You ask someone to open their mouth. The retropharyngeal space, it's located behind the pharynx. The prevertebral space is known also as the spine, right? The parotid space, pretty easy. And what's the nerve associated with the parotid space? The facial nerve. Where's the parapharyngeal space? It's located next to the visceral space. What's the name of the space that contains a carotid artery? The carotid space. The space below your tongue is the sublingual space, and the space below the mandible is the submandibular space. That's my timer telling me I'm done. So thank you very much for your attention.